Good evening, ma'am. Ma'am, you're on mute.
Yeah, yeah.
Good evening.
Good evening, Namrita. How are you, my dear?
I'm fine, ma'am. How are you?
Fine, fine, fine.
Today we'll go live on
अच्छा,
September. Everything is good.
ठीक है, चेक कर लेती हूँ, 1 मिनट, है ना? हाँ.
जी.
It's raining in Mumbai also.
There are clouds, but not really.
Here तो heavy rain, heavy. लाइव तो नहीं दिख रहा है बेटा मुझे. फिर से चेक करती हूँ, 1 मिनट. हाँ, है.
जी.
नेट का ही. So तो मारिया ज्वाइन नहीं हुई. I will tell her to join. Maria, please join, dear. Yeah, okay. Yeah. She's joining, huh?
Yes.
Namrita? Yeah. Blouse. मेरे
Yes.
बाल ना पूरे गीले हैं, इतनी बारिश हो रही है. मैं भी आई हूँ ना, पूरे ऐसे गाड़ी से निकलते ही ऐसे.
Maria ma'am is here.
हाँ. हाय मारिया, वेलकम.
Good evening,
हाय
ma'am.
मारिया.
Good evening.
गुड इवनिंग. वेलकम. हाउ आर यू? हाँ.
All good, all good. How are you? Two
फाइन
months,
फाइन
हो-
फाइन.
two
यार
months
कितना
हो
बारिश
गए.
है, बाप रे, है ना? अभी तो है. अभी
I
सोचो, मुझे
know.
वहां से यहाँ आने के लिए मैं थोड़ा सा भीग भी गई, मतलब जबकि छाता है, सब कुछ है, तो भी इतनी
I know.
बारिश है. रास्ते इतना ट्रैफिक, कितना जैम हो रखा है, बिल्कुल. हाँ.
I got
Ma'am, can
stuck. for
start?
1.5 hours. I got stuck for 1.5 hours.
Oh,
I'm
I know.
sorry to interrupt. So can we start? It's 8:30.
Yes, please.
Yes.
yes.
Okay. Thank you. Yes.
First,
Good evening.
she will introduce both of us, then we will take the questions. Yeah,
Okay. Fine. Okay.
yeah.
Okay. We are live now. Good evening and a very warm welcome to everyone. I'm Namrita Madesh, Community Manager at MediSage eLearning, a platform committed to empowering medical professionals through expert-led learning and meaningful collaborations. Today, we are excited to bring you a special cross-community med talk that bridges two vital specialties, gynecology and ENT, to address a topic of growing relevance, ENT complications during monsoon, a Gynae-ENT collaborative view with a focus on maternal care patients. And we are honored to have with us two distinguished speakers, Dr. Ritu Santwani and Dr. Maria Motiwala. Dr. Ritu is a renowned obstetrician, gynecologist, infertility specialist, and sexologist, known for her holistic approach to women's health. She holds prestigious qualifications including MBBS, MD, FECOG, FIAOG, and ART Singapore. She is the founder and CEO of 360-Degree Healthcare Studio, NUHS Singapore, a platform dedicated to comprehensive women's wellness, recognized amongst the top 50 most influential doctors on social media. Dr. Santwani is also the co-founder of MAM and a board member of SWWC, where she actively contributes to advancing women's health and empowerment on a global scale. Joining her today in this collaborative mentor is Dr. Maria Motiwala, an accomplished ENT specialist with over 20 years of clinical experience. She holds an MBBS and DORL and serves as an honorary consultant at Ruby Hall Clinic, Jehangir Hospital, and Inlas Budrani Hospital in Pune. Her clinical focus lies in vertigo and endoscopic ENT surgeries, and she is known for her evidence based, patient focused approach. Today, we welcome you to this session, and I now request Dr. Ritu take the session forward. Over to you, ma'am.
Yeah, thank you, Namrata, and thank you, Medisesh, for providing the platform for such academic initiatives. So, today the guest is none other my very dear friend, Dr. Maria Motiwala. Maria, a very, very warm welcome to you, my dear.
Thank
Uh,
you. Thank you, Ritu. Thanks, Namrata, and thanks, Ritu. I'm all good.
yeah,
Let's
yeah.
start.
Yes,
Yes.
let's start. So, friends, as we all know, this is the monsoon season. And yes, though we gynecologists, we are getting a lot of pregnant patients who are coming to us with a different ENT complaints. So that's why we thought, why not we call the expert today? And that too is the Maria, if is there, we can clarify each and every doubt. So there are a lot of ENT complications we are seeing in this monsoon season related to ear, related to nose, related to throat, that what the medication we can give, what medication we can't give. So besides that, there are some queries in the mind of the young PG students also related to the drugs, that which drugs are safe, which drugs are not safe, which drugs are having some interaction with other medications. So related to all that are today's focus of the discussion. So now coming to you, Maria, my first question is that in this monsoon season, why we see there are more problems in this ladies, the
Yeah. So,
related to ENT, of course. Yeah,
yes, of
yeah.
course, ENT related and in pregnancy. So, in pregnancy, this flu and cold is very common, and especially in monsoon area. Like, the monsoon is the climate changes, especially the moisture, the humidity, sudden change in the temperature. This all leads to a lot of infection. There are a lot of allergy in the environment. So it is this environment is more allergy potential and more of the moisture and humidity that makes the immunity little less, and we see lot of patients, especially the pregnant ladies, with lot of cold and flu. It can be viral and bacterial as well, like
Correct,
so
correct. Yeah,
they have to be
yeah.
very careful, like especially, and now the season is so bad, like the monsoon is ushered in with a very this, so everybody, I'll request all the pregnant ladies, they should be very careful and take care of their health.
Very true, very true. So this time the monsoon has come little early also. So we are
Yes,
seeing, yes, lot of patients are coming with the different complaints. So
absolutely.
yeah, so usually the patients, usually these days I am seeing the patients, lot of patients are coming with this ear discharge or earache. So I want first of all you highlight about this.
Yes.
Hmm.
The most common what in monsoon, especially as far as ear issues are concerned, yes, the severe earache. In fact, just last week I got a pregnant lady call at night, "Okay, doctor, I am getting a severe earache." So this because of this moisture, humidity, and water goes inside the ear canal. So immediately it picks up infection, and we get a severe otitis externa. Once you have this infection of this external auditory canal, the pain is the main thing. Like the pain is severe pain, like. And in pregnancy, as we know, we can't give any severe painkillers or anything. So we have to be very careful while treating. But earache and then slowly the otitis externa leads to otitis media because there's a lot of infection. So we can give otitis media also. So in an otitis media, the ear discharge, and in otitis externa, the earache. These two are the main complaint in monsoon in pregnant ladies, what we can see. So we have to be treated well, and early treatment is a must for this.
Very true. Very rightly you have pointed out. So we also tell our patients also that if you are having some kind of ear discharge or earache, so don't sit at the home as early as possible. Approach the specialist so they will guide you properly. Still, I am seeing, though we are in the 21st century, still the patients are coming, they are putting some oil. Ma'am, घर पे किसी ने बोला था, we have put some 2 drops of oil. Today
Yes.
only a patient told me that I this warm up this mustard oil and put some garlic also, and that I put in the ear, and that my ear is feeling now much better. And she was having bad cold. Still these things are going on.
Going on because they feel approaching and taking medicine will be harmful for the baby, like, or I don't know what is this. Now I see, first they used to tell humne thoda sa coconut oil or mustard oil we had put, and now they say no, we put olive oil. So what is the point in putting olive oil or
Olive
coconut oil?
oil.
Oil is oil, like, and especially while taking bath, if water clogs, especially in this monsoon season, so we can see more of the ear infection. So it is a very careful that the ear should be dry. There should be a ear plugs inside the canals while taking the head bath. So this is the most common, like, if water clogs in, the infection of the ear starts.
Correct, correct. So
Mhm.
my next question with you that now we are seeing a lot of patients with nasal blockage also. So what do you think that why this nasal blockage is most common in this pregnancy in this monsoon season?
Yeah. Especially the hormonal changes, what happens in the pregnancy and the environmental condition. So we know that a lot of physiological changes happens in pregnant ladies. So the blood flow increases, especially in the nasal passages. So there's a lot of congestion in the both the nostrils. So once the congestion happens in the nostrils, they feel the blocking of the nose more often. And when you see there is a lot of allergy in the environment, so your both inferior turbinates get hypertrophied. That's why the blocking is more common in that. So the main thing is steam inhalation is best. Whenever in monsoon, I will advise they should take everyday steam inhalation at bedtime. That is the best thing for the in the monsoon for the pregnant ladies.
So that's very good, very practical tip for the steam inhalation. So you suggest that they have to go for the steam inhalation directly, or they have to put some thing like this what are available, this inhalants and all that they have to add, or plain steam use think is much more better.
Plain steam inhalation is more than enough. Like people want some flavoring agents, like some this, that. But main
Uh,
important is steam. The plain water vapors is more than enough. There's no need to add anything. If you like some flavor or something, then it is a totally a different thing. But I feel only plain steam inhalation will reduce their blocking. It will reduce their swelling inside the nasal passages. It will help them to keep their mucus, the mucus warm. So the blocking, especially at night, what they get blocking of the nose, that can be reduced.
Correct, correct. So thank you. Now we are seeing, yes, I have asked about the something about the ear, something about the nose. Now coming about the throat. So we are seeing a lot of the patients are coming to us that they are having a difficulty in swallowing and having the throat pain. So how to manage these cases?
Yeah. See,
Of course,
yeah,
we are going to send you. Of course, we are going to send you. But what are the initial treatment we have to start?
yeah. See, sore throat is the most common complaint, especially in monsoon, in general public as well as for the pregnant ladies also. So sore throat can be like, there are different things. First, we have to divide. Why the sore throat? First, a very important thing is they get tonsillitis. That's a very common thing which we get it. So they may have a throat pain. It can be a reflux pharyngitis because in ladies, I have seen pregnant ladies, they get a lot of acidity because of the pressure of the expanding uterus. So because of the acidity, the silent reflux comes and burns your throat and gives you the sore throat, and we complain of the pharyngitis. So these two things you have to first take a precaution. Definitely, like steam inhalation, gargles, antibiotics, that management is there. But main important thing is see that your reflux, especially at night, the acid should not come in the throat. Otherwise, the sore throat will take a lot of time to go. And definitely for the pharyngitis and any kind of infection like tonsillitis, we can deal with proper medication inside for that situation.
Very true. Yeah. So coming to the in this context only, as we have just discussed about this ear discharge, some patients usually complain of the little bit of the hearing loss also. So what do you think that how can we manage this initial once the patient is approaching to us, the pregnant patient, madam, that I am pregnant, but still I am having some kind of the hear loss. So yes, what is treatment, what guidance we can give before we are referring to the patients to you?
Yeah, hearing loss is, I think, quite common thing. What we can see symptom in this pregnant ladies, and especially is monsoon, because automatically we have increased blood flow and blood vessels. It's more flow in the nasal passages. So definitely the congestion is more in the nostrils. So because of that, it is always we can't, the pressure inside the eustachian tube is not getting control. So they get a eustachian tube dysfunction or a eustachian tube block. As soon as the eustachian tube block happens, there is always a fullness inside the ears. And temporary, they may complain of hearing. They may complain of tinnitus also, some popping sounds because of that fullness inside the ears. So, especially the congestion, the overall increase in the fluid levels, the increase in the blood flow, that increases the congestion. It automatically goes for the eustachian tube, and temporary hearing is loss is there. So immediately, whenever you have a nasal congestion or a throat congestion, treat it before it goes to the ears and give you a temporary hearing loss.
Okay, that's very important point. So now
Hmm.
coming to in that constants only, usually what drugs we can consider which are safe during the pregnancy and what are the drugs which are totally contraindicated during pregnancy?
See, as we all know, there are many drugs which are contraindicated in the pregnancy. There are other like angiotensin 2 inhibitors, that antihypertensive, anti-seizures, benzodiazepines. We have so many live attenuated vaccine that I think everybody knows. But as far as ENT is concerned, yes, that is very, very important. What drugs can be given and what not to be given. First of all, NSAIDs. NSAIDs has to be like no, except like even only the paracetamol, aspirin, and definitely NSAID, Brufen. I have seen many people, they are used to, or the ladies are used to take Brufen. Headache, if they have, they take Brufen. Like, so Brufen has to be contraindicated. The best is to take a paracetamol, which helps to reduce the pain and the congestion. As far as antibiotics are concerned, definitely no for aminoglycosides like gentamicin, tobramycin, amikacin. This has to be not to be given. Then we have fluoroquinolones like ciprofloxacillin, then levofloxacillin, which is very common, moxifloxacillin, ofloxacillin, norfloxacillin. So these are the drugs which has to be totally banned or totally no further during the pregnancy in the infection pregnant ladies. The most common what we feel is coamoxiclav and cephalosporins. These are the more safest drugs to be given during the pregnancy for ENT infections.
Yeah. Thank you. Thank you so much. Yes, as we also know, and the point very rightly Dr. Maria has highlighted, this related to fluoroquinolone group and the aminoglycosides. Yes, a big no, because sometimes the patient before approaching to us goes to some family physician and without knowing the pregnancy status or without asking the pregnancy status, sometimes they start the fluoroquinolones and aminoglycosides. So that is a big no. So it's much better if you are pregnant and having these kind of symptoms, please first go to the gynecologist or visit to a ENT specialist. That doctor will guide you properly that how to manage further. Now, coming to the next question, the another common ailment what we are seeing these days is the vertigo in pregnancy. Lot of patients are coming to us that, ma'am, in this monsoon season, I'm getting the exaggerated vertigo. All the time I'm having the giddiness. So what do you suggest? How we can plan for that patients?
So first we have to understand what the patient is complaining. Vertigo is like a vast, whether
Correct.
spinning, balancing off, or blackouts, or there are so many ways like they say vertigo, like okay, it is just a spinning or it is just a blackout or just a off balance. So we have to understand what the symptoms are of the vertigo. And definitely we know okay, this hormonal changes happens in the body, and the blood flow increases during the pregnancy. So there may be an altered some blood flow inside the brain during while going to the brain, which give suddenly this spinning sensation to the pregnant ladies. So definitely the pressure, the high blood pressure also can increases the blood flow or alters the blood flow. That can also give giddiness type of the symptoms to the patient. So first of all, we have to differentiate whether when the vertigo is concerned, definitely we have to ask the ailment whether there is a previous history of positional vertigo or whether the previous history is of vestibular neuronitis. So that pregnant ladies may actually have vertigo. In some ladies, they just while getting up they get a hypoglycemic attack and they feel it is a vertigo. So differentiating a proper vertigo patient, or it is a hypoglycemic attack, or maybe because of the BP, or maybe just a hormonal or the change in the blood flow which reduces the blood flow in the brain, can give you suddenly the balance off. So once we diagnose whether this is an actual vertigo patient, then yes, there are few drugs which are very safe in pregnancy. Maclizine is very safe, and we can always give chlorpromazine also is very safe in pregnancy. So we can handle, and definitely we have the maneuvers, like we have Applu's maneuvers, Simont maneuvers. So we try all the maneuvers which are safe during the pregnancy, depending on what gestational age the pregnant lady is coming to us. Then we decide the maneuver which actually is safe for her to do it. Otherwise, we give this medicines, and diamond hydrator also is very good drug to
Yeah.
give during vertigo patients. And I think once we calm down, we explain them, they do fine during the pregnancy.
Correct. Yeah. Besides this medication, yeah, proper counseling is also very, very important.
Very
These kind
important,
of.
very important.
Huh?
Yes.
So,
Main is the
yeah.
counseling. Yes,
Yeah.
definitely.
So
Yes.
patient found that once the doctor is listening her thing properly, half of the ailment is already gone. And of course, the proper medication is must. Now
Yes.
coming to a very, you can say a funny kind of question also. Lot of time the patient's husbands come and ask that, ma'am, why my wife is having a snoring during pregnancy?
Yes. Yes, snoring is a very common symptom, and definitely the husband is the first one. I have seen the patient, the pregnant lady coming for throat infection, ear infection. Suddenly, the husband is next, and madam, any treatment for snoring? They don't want to complain to the wife or tell her that she is snoring, and they directly come with the complaint. Yes, because of hormonal and physiological changes, as we know, there is a lot of nasal congestion. As we have told, hypertrophy of the inferior turbinates, the blood flow increases. So we have nasal congestion. So the blocking of the nose happens and automatically the snoring happens. Then there is always swelling of the tissues in the airway passage during the pregnancy. So that may also lead to little bit of a harsh breathing type. There is also a fluid retention, so that's why the respiratory tract sometimes get narrowed little bit during the pregnancy. So that can also lead to little bit of snoring. But main important when the gestational age increases in that, the weight gain. So the
Correct.
weight gain, it increases all your tissues in the neck, and definitely the weight gain is the what we have seen more common, like that leads to snoring. So we have to explain to the husband that these are the things, and it is a temporary, it is just a weight gain or a detention of the fluid, and the blood flow has increased, so there is a congestion in the nose. And I think they do well. Little bit tips you have to give. Try to take steam inhalation, elevate your head, try to turn on the left side and sleep. A little humidifier can be used. So all this reduces the snoring. We can use the nasal strips also during that time. We get a strips nowadays. So temporary, the pregnant ladies can use the strips to reduce the snoring, and they do fine with that.
That's great. So that nasal strip has to be applied externally. What you
Yeah,
are,
yeah. You get
huh,
it in the any chemical. You have to tell them कि nasal strips for sewing. So they have
huh.
like this strip so that a little bit elevation happens of the nostril so that they can breathe like a little better way. So they do well, so little bit definitely helps. I will not telling it will help you. We can't do anything during that snoring. We know that this is a just a slow, just a passing symptoms, and that will reduce once once the baby is born. So tell them, and they do it, and they are quite happy, and they do it fine. Tell them to have a humidifier. Okay, use a humidifier. Take steam inhalation so that it reduces. In some patient, we give a nasal spray also. That also helps them, and they do fine with that symptom of snoring.
Thank you. Thank you so much. Dr. Mani, I've received one question. This is
Mhm.
Dr. Homika Jadhav. She has joined from the
Mhm.
Kolhapur. She dropped me in the Facebook Messenger question. Huh? So she is
Okay.
asking, ki, ma'am, this is a wonderful discussion. So will you please ask Maria Madam that how to manage the snoring in postmenopausal patients too? Yeah, that is also a very good question. Yes, postmenopausal patients का भी बहुत एक frequent ये complaint होता है snoring का. हाँ,
Yes.
हाँ,
See,
हाँ,
the first symptom, as you know, it is the hormonal changes. It is
हाँ.
totally a hormonal and physiological changes which leads to snoring. In postmenopausal, the first thing what we see is the weight gain. So I have seen these ladies having suddenly their weight increases. So that's why the tissues and all the of the neck increases, and that's why they lead to snoring. So first of all, you have to tell them the lifestyle has to be changed, reduce your weight, then check your, what we do is in postmenopausal, if the snoring we do, if there is a blocking, we see a ENT examination, we see whether there is a blocking in the nostril. Because in postmenopausal, there should not be a blood flow increases or a congestion. Definitely, she must be having something allergy problem or a deviated nasal septum or other ENT issues. So that is totally different. We have to do a scan. Sometimes we have to do a sleep studies and to check whether it is going to some pathology issue or it is just a physiological issue. If just a physiological issue, then definitely all that tips elevate the head, use the nasal strips, and try to take steam inhalation, the spray, and main important is reduce the weight. That will definitely, I will say, the snoring will remarkably will reduce.
That's a very important and very practical point. Thank you for sharing this.
Yes.
So, Namrata, have you received any online questions?
Yes, ma'am, we have received some questions. I'll post it in the chat box. Yes, and
You
I'll
can.
read it out for you.
Yes.
Yes. The first question that we received is, doctors, how do ENT infections influence chronic inflammation or immune responses in women undergoing IUI or IVF cycles?
So, doctors, how do ENT infections influence chronic inflammation or immune
Immune.
responses? Yes, ENT infections is more of the main thing is yours. Main thing is your immunity response. We have to do ENT infection is directly related to immunity. The nose, main is your nasal passage where all allergens enters in your body. So that is the ENT infection first. If you get a nasal congestion, if you get any allergic rhinitis, that ENT directly will reduce the immune responses and it will reduce the immunity in the body. If we find that the patient is having recurrent allergic rhinitis symptoms like sneezing, running nose, and all that, we do an immunity workout, like we do IgG and Ig levels and treat accordingly. So, definitely, ENT infections are directly related to the immunity response. As the nose is the first thing we get directly allergy inhaler by what the patient is getting the allergy symptoms from there.
Do
Thank you.
you
Thank you.
do you routinely screen for ENT health in preconception or antenatal counseling, especially in high risk or asthmatic patients?
Yes, definitely. If the patient comes to us and they are planning to conceive, that is the time I get many of my patients and they tell, "Ki, Madam, we are trying to conceive and we have a breathlessness and COPD patients." Definitely, we have to screen them. We have to plan, and some patients, so they come with a really deviated nasal septum. She has a little blocking of the nose, often on allergic symptoms. So these patients, we have to take out this allergic rhinitis, deviated nasal septum, COPD patient, like asthma patients. So this has to be screened out, and we have to plan a proper treatment and management so that the patient is having less symptoms as much as possible during their pregnancy. So for asthma patient, we put them on the spray, like Asthalin spray, as we know, it is safe during pregnancy. We tell them keep a nebulization machine, so that will help them to reduce their this. Deviated nasal septum, now there is no time for the surgery or to do anything. So nasal sprays help them a lot. A steam inhalation, which is I told a common thing which can help them. Allergic rhinitis, which is very common, and we see in so many patients in pregnancy, ladies in monsoon season. Sneezing, they sneeze like anything, running nose, all the time they are having these symptoms. So some nasal sprays, and as we know, fexofenadine or cetirizine, that helps it. So we tell them to use these drugs before it comes to a more complications and leads to sinusitis and infection. Use a nasal spray and an antihistaminic, which is safe during the pregnancy.
The next
Very right.
question that we received is, ma'am, what is your approach to managing seasonal ENT flare-ups in patients on hormone therapy or post-operative recovery from gynae procedures?
So,
See, we gynecologists find the ENT surgeon very difficulty, so that's why all the questions are getting bombarded to you.
no, most welcome. That is not a problem. It's a most welcome. But some questions are really complicated. Definitely, first of all, uh, such patients, like, if you have the problem, you have to tell. My request to the gynecologist or a GPs of this is, tell them to visit ENT. ENT examination is very, very important. Especially we feel, okay, nose, they are having sneezing, they are having running nose, they are having this. But when I see a patient of allergic rhinitis, a ENT, I have so many things when I examine and check the nasal passage. We see lot of, like, there are a lot of changes which tell us that, okay, this person have allergic rhinitis from since a few weeks, this patient must be having since months, this patient may be having seasonal and must be having years. So there is all, we can see a pallor. The main thing is pallor in the nasal passages, which tells you the inferior turbinates, the lining, the mucosa, the postnasal drip. These are the many things which we decide whether this patient requires a more lineup treatment, or whether this patient can come a seasonal, just take the sprays, just take the medicines, and that patient should be fine. So I will request all the gynec and GP, if you get such patient, please tell them to visit an ENT. You can call directly an ENT, ask them, so that ENT can tell you exactly like what is exactly the plan, and then you can take over and plan for your patients.
Very true. So, Maria, I think better we will send to you if we tell the patient that we are calling in front of you and taking a opinion. Patient then would be ready to come to the ENT specialist. They told, ma'am, आप ही treat कर दो, phone पे पूछ लो, आप ही medicine बता दो. So, yes, a very good point you have told us. Yes, definitely. If the patient is suffering from these ailments, yes, definitely it's our duty to send to a ENT specialist. I'm able
Yeah.
to see one question, and that question has come in my mind also related to the steroid use. That how much is the efficacy and safety of the steroid use? Because for lots of the ENT ailments, ENT specialists are giving a minor dose of the steroid. So, what do you think? How much it is safe and we can give for these ENT procedures? Sorry, ENT ailments. Huh?
Yes, I agree. Steroid has a very important role in, especially in allergic rhinitis, or in very severe cases of throat or a ear infection, especially otitis externa. In severe otitis externa, you can't treat them without giving a little prednisolone or little short course of 3 days or 5 days, because that helps to reduce the swelling fast. As far as ENT is concerned, we don't use a very higher dose of drugs. We use very minimal dose of drugs, and whenever it is required in severe cases, then only. So maybe 3 to 5 days is more than enough. But when nasal polyp, now nasal polyps, the allergy rhinitis leads to a nasal polyps. The polyps, the treatment itself is steroids. Patient will not get any relief, any blocking without using the steroids. So what we do, we give a oral steroid for maybe a week or so, and then we switch them to the intranasal steroid sprays. Now, intranasal steroid spray, there is not much absorption. There is hardly minimal absorption in the body. So the intranasal steroid spray, they can use for weeks, they can use for months. Some patients use for a year also, but otherwise they can't breathe. So the immunity, once they can't breathe, they are breathing through mouth. So all the lung diseases, the respiratory tract. So rather than making their disease more complicated, it's better to use the intranasal steroid, which has hardly any absorption in the body. So it's better to have intranasal steroid rather than oral steroids. Yes.
So yeah, the tip of the day that instead of using this oral medication, this local application will be much more better. Yes, in the form of the drops. Yeah. Any more question? Yes, I am able to see. And Amrita, you can take the
Yes.
question. Then we
Yes.
will wind up.
How
Yeah.
do you handle ENT related complications in postpartum women, especially those recovering from C-sections or episiotomies?
See, that is a very big question. ENT complication. So, what ENT complication? Ear, nose,
Huh.
throat. What do you mean by that? So if you
Hmm.
tell in postpartum, the ENT complication can be only, what I can see is epistaxis. There can't be postpartum. You can't have an infection of the earache. I think in postpartum, you already give after C-section, you're loading the patient with antibiotics, you're giving the painkillers, you're giving everything. So that can take control of the throat infection, that can control of the ear infection, and you can put a local ear drops which will reduce the swelling. What I can see a more challenging of ENT complication postpartum is epistaxis, which is very difficult to treat. Yes. The pregnant, just the immunity of that lady is so reduced. And once she start pouring the blood from the nose, we have to take her. First, we try to do with the packings like a nasal
Exactly.
anterior packings. Otherwise, sometimes we have to take her into the operation theater, do the endoscopy, check the blood vessels, and cauterize that blood vessels during that time. That is what I have seen, and I have done a ENT complication postpartum up till now.
Very
Thank
nice.
you,
Very
ma'am.
nice.
These were the questions we have received from our audience.
Yeah.
Thank you for
Yes.
answering them.
Yeah. So today we are perfectly on time. So yes, our show timing is for half an hour. And Maria, later on I will send you the YouTube link, and the program has gone live on MediSage app also. So yeah, thank you once again for accepting the invitation and such a nice discussion for clarifying lot of doubts which are all in the mind of the gynecologist, not only the young gynecologist but in the senior gynecologist also. So
Definitely,
thank you.
definitely,
Yeah.
definitely.
Thank you.
Thank you, Ritu and to Namrata. And
Thank you.
hope the doubts are cleared. And
Yes,
anytime
Yes.
we should have the tips in
Huh.
the pregnancy is just hydrate yourself and keep your immunity strong.
yes.
Very nice.
Thank you,
Very
Dr.
nice. So
Maria. And
I hope to
yes,
have you once again in the session for clarifying such much more doubts what we are having. So soon I will take your date and we will have one more session with you.
Thank
So
you.
yeah.
Thank you.
Yeah. Yeah, Namrata, you can give the closing remark. Yeah.
yes, thank you. Thank you, Dr. Maria and Dr. Ritu Santwani, for an insightful and clinical meaningful session. Your perspective from ENT and gynecology have enriched our understanding of seasonal health issues and patient care during monsoon. And to our viewers, thank you for joining us. We hope this Med Talk sparked important takeaways that you can apply in your own clinical practice. Don't forget to explore more such expert-led sessions on MediSage app. Stay tuned, stay informed, and stay empowered. Until next time, good night, everyone.
So good
Thank
night,
you.
everyone. So before we wind up next week, we are having two sessions on the one on the breastfeeding, another on the breast lesions. Maybe by tomorrow or day after tomorrow, we will post the details. So all of you are welcome to join for that interactive discussions. So once again, thank you, Namrata, and we will wind off here. Bye bye.
Thank you.
Good
Thank you.
night. Yeah.
Good
Good
night.
night.
Thank you.
Good
Thank
night.
you.
Good night. Good night.